Hello, everyone, and welcome to PetWise.vet, the app that has taken ChatGPT and really revolutionized it for us to be able to create our SOAP records as well as to develop and research our textbooks without having to actually open them. I'm Dr. Stacey Gastis, and this was born on the floor in a very busy veterinary hospital and developed in real time. So we took away all of the barriers to that would impede us from our workflow. So I'm going to get right into the app itself. You'll know here, so you know, we're using ChatGPT as the background. That's where this all pulls from. But the sources, what we told it to do was to go and pull sources that we would trust. So sources like Merck, Plums, 5-Minute Consults, Journal of Veterinary Internal Medicine, just to name a few. Okay, veterinary ophthalmology, these universities, Cornell, and on down the list. So you can see this is where we're pulling from when we get our data. The initial function that I'm going to show you is actually creating the PetSOAP. As we go on, I'm going to show you a complicated one. There's very easy ways to do this. We put our pet info in here. Very typically, even to shave time for me, I'll just go in and say, okay, I have a canine patient. I'm not even putting any more signalment in. And I'm going to go with vomiting, diarrhea as the presenting complaint, okay? And I will go here to skin and say, let me go with the skin tent, okay? And I'm going to have it actually generate a medical record right without putting any more parameters in. What we've done is we've instructed it to write the most typical history, pulling online from all veterinary literature, what's typical in our patients like this. We'll see what it comes up with. The more I put into this aspect in my diagnostic tests, if I leave them blank, this will actually show me and tell me what to do. Now I'm going to jump, it comes in a SOAP format, so I can copy paste each aspect into my PIM, okay? But I'm going to go into the standard so you can see it very quickly. There's my presenting complaint. This is all that I put in, as well as a skin tent here. It preserved that. It's now suggesting my diagnostic tests that I should do. I can pick and choose these. It's going to give me an assessment. Consistent with gastroenteritis, laboratory tests may reveal electrolyte imbalances. There's my assessment. I can get in and edit this as I need to, delete and edit as I go. Diagnosis, it's going to throw a gastroenteritis, dehydration as my primary two on my problem list. It's going to give me my differentials on all of each one of those automatically. I didn't have to put them in on this side. It's going to suggest a treatment plan for gastroenteritis, metronidazole, Cerenia, including doses, pulled from our veterinary literature, probiotic supplements, supportive care. All right, fluid therapy, administer IV sub-Q fluids if indicated, monitoring, client communications. It'll suggest what I would have normally talked about. And all of this is done without dictation, and I just simply went in and typed in vomiting, diarrhea, and skin tent. And I can put more data in as my diagnostic tests come in, because I can save this record. I can go back and go into my saved records. There it is. This is all done on the cloud. So I can load it back into the generator as I go, as my case develops through the day. And I can regenerate every time I do this. I can generate that record again. All right. The next function I'll show you is the PetQuery. This is where I would go to ask anything I want to about what may be on my mind, veterinary related. In this case, I've copied from a list that I have that could be typical. I'm going to paste it in. Grading murmurs with auscultation zones for diagnosis of cardiac defects in the canine. Okay, so I have those with me clinically, but what I want to do is I want to refresh myself with this. Okay, so it's going to give me an overview. It's going to give me a grading system up to 6, of course. It's going to give me auscultation zones, point of maximal intensities, so we can see this is a very quick access. Yep, I've got it. I don't have to go to a 5-minute consult. and I can look at the sources. In this case, we're looking at Ettinger, vet cardiology, and we can see the dates here. Let me go do one more on a query, because it's endless in terms of what I can put in there. Let me do a case input here. I'm going to copy paste one that I actually had a couple of weeks ago. In this case, it was lab data that came back for a patient. I'll clear this chat. I'm going to input it. What I did here was I actually copied and pasted the lab data right from Antech, our lab. So my instruction to the AI was write a complete assessment differentials comprehensive plan, and that I reported this to the clients. That's all in there. Now it's going online and it's pulling, and it's gonna formulate this all together. So I don't have to print any of this, but what I can do is I can take what it gives me as a product, and I can edit it to my needs. Okay. In this case, it's giving me an assessment, high specific gravity, high pH, protein, 1+ on the stick. You can see it's going to give me differentials. All right. It's going to give me suggested diagnostics that I may or may not want to do. Treatment recommendations, antibiotic therapy, client communication summary. I'll copy this, paste it in my PIM, and I'll edit it in my PIM in terms of I'll delete and copy and change, and then I go off to the next case. This is typically, I'll do this if I'm phoning somebody and it's a complicated case. In this case here, I'm going to ask the AI to create a client handout for hookworm prevention that I can print and hand to my clients in the room, what they can do for home care. So in this case here, it's going to tell me what hookworms are, ingestion of larvae, skin penetration, everything I want to know, how we actually handle it, fenbendazole, and I can have this into Spanish or any language that I want. It'll take it, rewrap it in Spanish. I've asked my Spanish clients whether the translation is good. They say it is. There's another function that we have, and that's my templates. In my templates, I'm going to pull up an annual vaccination for a dog. I'm going to copy this to the clipboard, go into my PIM, and paste it in there, and then I can go in and my template, I can alter whatever I want in my physical exam findings, typical diagnostic tests. If I need to change this, I can go in and change them. And then I'm off to the next case, all right? My templates, we can create anything that we want. We can pull it up, we can search our templates here, and we'll be able to actually line them up in whichever order we want to be able to do that. Okay, so this concludes introduction to PetWise.vet. Very powerful app, leveraging ChatGPT to deliver for us veterinarians what we need on the fly to get us out on time, to also leave us less exhausted at the end of our days, and to also deliver the best medicine that we can to our clients and above all our patients. Thank you.